people do not realize how serious high blood pressure is simply because most people that have high blood pressure do not have symptoms. It's called a silent killer because it can affect your brain, your heart, your kidneys without you even being aware of it. We know from studies that people that have high blood pressure are 4 times more likely to die from a stroke or to have a stroke, and 3 times more likely to have coronary artery disease as well. So when you get to your doctor's office, they take your blood pressure, and there are 2 numbers that they usually tell you. The top number is called the systolic blood pressure, which is the blood pressure when your heart is beating. The other number, which is the bottom number, is called the diastolic blood pressure, and that's the blood pressure when your heart is at rest in between the beats of the heart. And those numbers are very important. So obviously when you have a high blood pressure, it impacts not only your blood vessels, but your organs, now in particular the brain and the heart, and it puts a strain on them. So people that have a prolonged elevation of blood pressure for years without controlling it, their hearts can get bigger. And as it gets bigger, it can fail, what we call heart failure. And so that can have an impact. And obviously on the brain also, very high blood pressure has a risk of leading to stroke, and that can lead to a lot of hassles and sickness and hospital visits. It's very normal for your blood pressure to fluctuate during the day. Your blood pressure fluctuates in response to anxiety, to stress, but as long as it doesn't stay high, it should come back down to normal. That's the most important thing. If it stays high persistently, then we begin to have problems. There are certain risk factors for developing high blood pressure. If you are overweight or obese, if you smoke cigarettes, those are risk factors. And if you have a family history, one or both parents, is also a risk factor. But there is hope. There is a way out, I've had patients who have made lifestyle changes and who have lost a ton of weight and whose blood pressure came back to normal. And these are the things we emphasize in primary care, that losing weight and eating healthy and making healthy choices day to day can, reduce your risk.